All right, today we are diving into a really powerful technique that comes from narrative therapy. It's called mapping the influence, and it's a way to completely flip the script on how we look at our biggest challenges.
You know that feeling, right? When a problem, say anxiety or guilt, or even procrastination, just feels so huge. It starts to feel like it's not just something you have, but something you are. It's no longer, I feel anxious. It becomes, I am an anxious person. Well, we're going to look at a therapeutic approach that pushes back on that idea hard.
So here's our game plan. First, we'll cover the core idea. The problem isn't you. Then we'll define what mapping the influence actually is. We'll look at the practical side with the two-sided map, explore why it works so well, and finally, touch on some potential roadblocks. All right, let's get into it.
So, first things first, we have to get our heads around the big idea that makes this whole thing possible. It's a really fresh perspective that comes straight out of narrative therapy. And this right here, this simple phrase, is the whole foundation. The person isn't the problem is the problem. What it's saying is that your issues are separate from you. They are not some permanent part of your personality. Think of them more like external things that have an influence on your life, but they do not define who you are.
Okay, so if the problem is this separate thing, how do we start to deal with it? How do we even begin to understand our relationship with it? Well, that leads us right to the practical tool at the heart of this explainer.
Mapping the influence is, at its core, an investigation. It's a way of asking questions to explore the life of the problem, to see how it operates. And in doing that, you start to separate it from your own life. The whole goal is to stop seeing the problem as some flaw inside you and start seeing it for what it is, an outside force that has a real, measurable impact, but an impact that isn't all-powerful.
This whole approach was pioneered by a therapist named Michael White, and the real genius in his work was this idea of relative influence questioning. He realized this isn't a one-way street. The map doesn't just look at how the problem affects you. It also looks at how you affect the problem. It's a two-sided relationship.
So what does this investigation actually look like in practice? Well, it unfolds through something called the two-sided map. It's all about charting the problem's influence versus charting your own strength.
The whole process is really broken down into two clear phases. In phase A, all the attention is on the problem. You might ask questions to trace how something like guilt messes with your work, your friendships, how you see yourself. But then, and this is the game-changing part, comes phase B. This is where you look for the exceptions. You hunt for evidence of the times you stood up to guilt, when you resisted it, when you did what you wanted to do anyway. It's all about finding proof of your own strength.
And the effect of doing this is pretty profound. When you map both sides, the problem stops being this vague, overwhelming cloud of despair. Instead, it becomes a specific adversary, something with clear boundaries. You start to see where the problem has power and, crucially, all the places where it doesn't.
Now, this process of turning the problem into an external thing and really defining it, it has some incredibly powerful benefits. So let's break down exactly why this map can be such an effective tool.
First off, it's empowering. Just by finding those moments where you resisted, you prove to yourself that the problem doesn't control 100% of your life. Second, it doesn't pathologize you. It doesn't slap a label on you like depressed or anxious. The map is the diagnosis. It's this living picture of a relationship. And finally, it gives you a clear way to see your progress. As you get stronger, you can literally see the problem's territory on the map start to shrink. But, no technique is a silver bullet. It's really important to have a balanced view. Mapping the influence isn't a perfect fit for every single person or situation, and there are some potential roadblocks worth thinking about. For one, all this metaphorical thinking can be really mentally tiring, especially if someone's already dealing with severe depression. Some critics also point out that splitting the person and the problem so cleanly can sometimes feel a bit artificial. And a big one is this: if a therapist moves to phase B, to charting strengths, too quickly, it can feel like the person's pain and struggle is being brushed aside or minimized. But even with those limitations, the core value here is just so strong. The main takeaway from the analysis is that the real power of mapping is its ability to define the problem's borders. And once something has borders, it's no longer infinite. It's no longer everywhere. So let's bring it all home. The crucial point is this: mapping the influence isn't about ignoring a problem or pretending it doesn't exist. Not at all. It's about getting to know it, understanding how it operates, and most importantly, drawing a line in the sand. It's about defining the problem's territory so you can finally see where it ends and where your own influence, your own values, and your own strength begin.
And that really just leaves us with a final thought. When you treat a problem like it's something separate from you, you give yourself space. Space to fight back, space to negotiate, and ultimately, space to reclaim your own story. So the question is, what problem in your life could you start to map?